Looking around the nation now. Today, Senate Majority Leader Mitch McConnell delayed the Senate's August recess to give them more time to work on a health care replacement bill.
We will be in session the first 2 weeks of August that we had originally anticipated not being here. We will be here.
All right. Today, McConnell said that the final version of the revised GOP health care bill will likely retain the tax boosts on wealthier Americans put into place by Obamacare. Now, he wants a vote next week so lawmakers can move on to other priorities before their summer break. And as you know, Congressman Mark Amodei voted in favor of the American Health Care Act, but of course that was a different version of the bill. Paul Nelson sat down with Amodei for a story you'll see only on Channel 2. And Paul, there are a lot of moving parts to this legislation, huh?
Yeah, everything from Medicaid expansion to pre-existing conditions, Landon. Amodei says there's a lot of good things about the Affordable Care Act, but that a lot of things aren't working. A big question is how to cut costs without people losing their health coverage.
The health care argument continues, and while many would like to see a repeal and replacement of the ACA, it's more likely parts of the law are here to stay.
From prenatal to death, it affects everybody, even more so than taxes.
Congressman Amodei originally opposed the American Health Care Act. It looked like Nevadans would either lose Medicaid expansion coverage or the state would be on the hook for $250 million to pay for it.
I don't know whether it's a right or not a right, but if you've got health care right now, regardless of the source, I really don't want to see you booted off.
Amodei eventually voted for the bill after a closer look. The House version would allow people to stay on Medicaid expansion until they're 65 and eligible for Medicare. They could sign up for Medicaid expansion through 2020, and the federal government would still pay 90% of the cost. But that's a much different version than the one the Senate's negotiating.
I hope they get together on something, though, because the status quo, to go back to where we started, status quo with the ACA, quite frankly, is it needs work. So we need to start the process of working on it.
Amodei says some of those problems are higher costs for premiums, deductibles, and copays, and Medicaid expansion doesn't have a designated revenue stream to pay for it, and the federal deficit is nearly $20 trillion.
When you talk about where 70 cents of every federal dollar is, Medicare, Medicaid, Social Security, and interest on the debt, it's like you're not going to balance the budget in the other 30.
About 40% of federal spending is borrowed money, and a big part of tax reform and balancing the budget depends on health care spending.
But with all due respect, it's not do I have a heart or don't I have a heart. It's that I don't have the luxury of just going, we're just going to concentrate on the benefit side and not worry about the cost. I don't think you can.
More than half of Nevadans have employer-provided health insurance, but about 20% are on the health exchanges or buy their own private insurance. Amodei says those are the ones who are struggling with the current system the most. Covering the story live in the newsroom, Paul Nelson, Channel 2 News.
Looking to our community now. Tomorrow you can help save lives by giving blood during our 10th annual Give to Live blood drive. It's from 11 to 7 at the Atlantis in the Grand Ballroom. We'll be taking donations all day from you there. All people who donate will be entered into a drawing to win a motorcycle as well. It's part of their Summer Ride for Donors program. So please come on out. We hope to see you there.